Hello and welcome. Thanks for joining me today for a Medicare coverage neighborhood meeting. Let's start with who we are and what we do. You can trust Wellcare for coverage that goes beyond basic Medicare. Medicare Advantage plans from Wellcare support your total well-being and help you live a better, healthier life. You'll find that our plans cover everything that original Medicare covers, and then some. Today, you'll learn about the basics of Medicare, the advantages of Medicare Advantage, and why Wellcare may be the right choice for you. Presenting this information is a licensed Wellcare plan representative. Selecting a health plan can be complicated, but we're here to help. This easy-to-follow video explains Medicare in simple language. Let's start with the basics. What is Medicare? Medicare is a program administered and regulated by the Centers for Medicare and Medicaid Services, CMS. You are eligible for Medicare if you are a citizen or permanent resident of the United States, age 65 or older, under 65 with certain disabilities, any age with end-stage renal disease, ESRD, or amyotrophic lateral sclerosis, ALS, also called Lou Gehrig's disease. This video will help you understand original Medicare and how it compares to Wellcare Medicare Advantage plans. Let's go over the 4 different parts of Medicare. Part A covers inpatient care, a skilled nursing facility, hospice, and some home health care. You will have out-of-pocket costs for your hospital stay, such as deductibles and coinsurance. If in a skilled nursing facility more than 20 days in a benefit period, there may be out-of-pocket costs. There may be a monthly premium as well. Part B helps with the costs of doctor visits, outpatient services, and some preventive services. With Part B, there are additional costs, such as a monthly premium. Parts A and B together are called Original Medicare. Part D helps to cover the costs of prescription drugs. To receive drug coverage, you have to purchase a prescription drug plan to add to your original Medicare, or enroll in a Medicare Advantage plan with Part D prescription drug coverage. Part C is Medicare Advantage. When you join a Medicare Advantage plan, you get Part A, Part B, and usually Part D coverage to support your total health in one plan. Wellcare offers different kinds of Medicare Advantage plans, like Health Maintenance Organization, Preferred Provider Organization, Private Fee-for-Service, Dual Eligible Special Needs Plans, and Chronic Special Needs Plans. Other types of plans may be available to you. Ask your licensed representative for details. Enrollment rules for many Dual Eligible Special Needs Plans, DSNPs, have changed for 2025. Your window to enroll in a Wellcare Dual Eligible Special Needs Plan, DSNP, may be limited in 2025. Now let's see how a Medicare Advantage plan compares to Original Medicare. Basic Original Medicare is just a starting point that covers doctor visits and hospital stays. Usually, you pay a monthly Part B premium and must meet yearly deductibles. Original Medicare will then cover 80% of the approved amount, and you're responsible for the remaining 20%. There's also no limit to your out-of-pocket costs each year. To see what's available in your area, please see the summary of benefits for details on the specific additional benefits in each plan. Now, let's talk about Part D. Medicare Part D is coverage for prescription drugs. You don't automatically get this coverage when you become eligible for Medicare. Yet, many Americans rely on prescription drugs to maintain their health and well-being. It's important to consider whether you need a plan with prescription drug coverage. To receive drug coverage, you can join a Wellcare Medicare Advantage plan that includes prescription drug coverage or standalone prescription drug plan. Medicare Part D covers brand name and generic prescription drugs. You generally pay less or nothing at all for generic drugs. A formulary lists the drugs your plan covers. Medicare Part D has 3 stages, and the amount you pay to fill your prescription drugs depends on which of the 3 payment stages you're in. Annual deductible. The amount you pay before a plan covers your prescription drug costs, if applicable. Initial coverage. During this stage, the plan pays its share of the costs, and you pay your share. You are in this stage until your payments total $2,000 for the year. Catastrophic coverage. After your out-of-pocket costs for prescription drugs reach $2,000, you pay $0 for both brand and generic medications for the remainder of the year. Deductibles vary by plan. Not all plans have a deductible. Find out if you qualify for Extra Help. Extra Help is a Medicare program that helps people who have limited income and resources pay Medicare prescription drug program costs like premiums, deductibles, and co-pays. Depending on your income and resources, you may qualify for Extra Help. To find out if you qualify, simply call the Social Security Administration at 1-800-772-1213, TTY 711, Monday to Friday, 8 a.m. to 7 p.m., or visit www.ssa.gov/Part-D-Extra-Help. You need a plan and benefits that support the bigger picture of your health. Yes, that includes the hospital and medical coverage you would get with original Medicare. But you deserve something more. Now you can choose a plan with extras that add to a healthier you. Best of all, when you choose a Wellcare Medicare Advantage plan, you can keep your health and well-being in balance. We partner with experienced medical providers, specialists, hospitals, and pharmacies in your area. And now, your local representative will cover all the benefits, services, and providers available on plans in your area. It's time to review plan documents, including the summary of benefits, with your licensed and certified WellCare plan representative. This helps you make a good decision about your Medicare coverage and to enroll in a plan that goes beyond the basics so you can live a better, healthier life. Now let's talk dates. Initial coverage enrollment period starts 3 months before your 65th birthday month and ends 3 months after your 65th birthday month. You can join any plan. You need both Part A, hospital insurance, and Part B, medical insurance, to join a Medicare Advantage plan. You need either Part A or Part B to join a Medicare drug plan. Coverage starts depending on when the plan gets your request. If you request to join a plan before your Medicare coverage starts, your coverage would start the same day your Medicare enrollment month starts if you enroll before your Medicare entitlement month begins. Or, if you request to join a plan after your Medicare coverage starts, your plan coverage starts the first of the month after the plan gets your enrollment request if enrolling after your Medicare entitlement month starts. Initial enrollment period. New to Part B only if you get Part B after your Part A coverage starts. The enrollment period is the 3 months before your Part B starts. You can join any Medicare Advantage plan with or without drug coverage. Coverage starts the same day as when your Part B coverage starts. Annual Enrollment Period. The annual enrollment period for 2025 starts on October 15, 2024, and ends on December 7, 2024. During this period, you can enroll into a Medicare Advantage plan from Original Medicare, enroll from one Medicare Advantage plan to another, enroll into Original Medicare from a Medicare Advantage plan. Coverage starts January 1st of the next year. Enrollment rules for many dual-eligible special needs plans, DSNPs, have changed for 2025. Your window to enroll in a Wellcare Dual-Eligible Special Needs Plan, DSNP, may be limited in 2025. Medicare Advantage Open Enrollment Period. The Medicare Advantage Open Enrollment Period starts January 1st and ends on March 31st. During this period, you'll have a one-time opportunity to enroll from one Medicare Advantage plan to another, enroll from a Medicare Advantage plan to Original Medicare with the option of enrolling in a Part D standalone prescription drug plan. Special Enrollment Periods. You could qualify for a special enrollment period during any month when certain events happen in your life, even if it's outside of annual or open enrollment. You may qualify for a special enrollment period if you move, you are eligible for Medicaid, you qualify for extra help with Medicare prescription drug costs, you are getting care in an institution, like a long-term care hospital, you lose employer group coverage, or you are enrolled in a state pharmaceutical assistance plan. Ready to sign up? We make it easy. You can enroll through a licensed representative by visiting us online at wellcarenow.com or by calling 1-877-MY-WELLCARE, TTY 711, 8 a.m. to 8 p.m., 7 days a week. After you've completed your enrollment application, you'll receive important information and materials about your new plan, including your ID card, member welcome kit, and welcome call. Thank you. Please tell your friends and family about your decision and the reasons why you have selected Wellcare as your Medicare Advantage health plan.